be hosted by Amazon. The title of their session is Pharmacy, Reimagine, Bringing Healthcare to Where Patients Are. Please turn your attention to the big screen.
You told Mom to send her prescription to Amazon Pharmacy. She didn't. Now you're stuck behind this guy, as he uses the pharmacy line to purchase half the store, including a ceramic dolphin figurine, without a price.
Price check in pharmacy.
All Mom had to do was use Amazon Pharmacy, and her meds would get delivered right to her door.
Welcome to the stage, Dr. Lauren Lau-Stokes, Head of State Pharmacy Policy at Amazon, and of course, our own alma mayor, Mayor Leonardo Williams of Durham, North Carolina.
Good morning, everyone. Good morning to everyone who made better decisions last night to get here on time this morning. So thank you all for being here. I'm Mayor Leo from Durham, North Carolina, and I'm grateful to share the stage with Dr. Lauren here. And before we get started, I just want to brag on her just a little bit. You never know who is, follow me when I say this. You never know who's in your household, all right? I was talking to my wife, and we were talking about some medication that she had to get, and my wife does this thing, and I do it sometimes too. It's a really dangerous and bad habit, but we get on our phones late at night, and we start to buy things, and then you wake up the next morning, you're like, what did I do? This time she was a little responsible. She was getting her medication through Amazon Pharmacy, and and I never knew I was going to end up, meeting Dr. Lauren or having this conversation. And here we are. And I was telling her about it. She was like, "So how was it?" I was like, she said it was easy, simple. And she's like, "Yeah, what else?" I was like, "That was it. It was easy, simple." And I think that that's kind of what we're looking for. So it's great to be here with you this morning.
Likewise.
And can I brag on you just a little bit?
Yeah,
just a little bit here. So I'm on the stage with Dr. Lau. She's the head of Amazon state and local pharmacy policy and advocacy. Before joining Amazon in 2025, she served as vice president of reimbursement at the National Association of Chain Drug Stores, where she represented over 40,000 community pharmacies before state and federal policymakers. And she previously served as health legislative assistant to U.S. Representatives Bradley S. Snyder, a Democrat from Illinois 10, and Yvette Clarke, Democrat New York 9, and a host of other things. But I'm going to ask her to also give us a little more information about herself rather than me reading the gamut on your bio here. So welcome to the stage, and it's great to have you.
Thanks, Mayor Williams. It's great to be here. And Alma, thanks for having me. It's, again, a pleasure to be here with you guys this morning and be a part of the session and have a conversation about not just Amazon Pharmacy, but how we're trying to figure out how to simplify healthcare. And so I don't know if you want me to dig a little bit deeper now into the background.
Why don't we let's start at the beginning.
Yeah.
You tell us a little bit more about yourself and, just what drew you to, let's say, public policy as a pharmacist. I know where I'm from, Eastern North Carolina originally, people get sick, they die from the same thing, and access to medicine is one issue, and everybody's waiting on the Lord, and the doctor said I had, 6 months to live, but the Lord, and I'm still here. So what got you into this space to help change that culture?
Yeah, no, I appreciate the question. I appreciate the moment to be on this stage to talk about it because I'm a proud native of Jackson, Mississippi, so you'll hear the accent come in and out. But I went to pharmacy school at Ole Miss, which was our only pharmacy school at the time. And my whole goal was to figure out how I can best serve the patient, right? My grandparents died from chronic diseases like diabetes, hypertension, heart failure, and these are all chronic conditions that are preventable. And so during my rotations and throughout pharmacy school, I was working in the ICU at the University of Mississippi Medical Center, and majority of the patients in the ICU looked like me. And it looked like my parents and my grandparents. And so it really lit a fire under me to figure out how I can serve and have a macro level impact. I mean, I was doing the day-to-day, right, serving the patients at the hospital and at the community pharmacy. But after doing an internship in DC at the National Community Pharmacists Association, NCPA, which represents independent pharmacy owners, I got my first foray into public policy. And I got to go to the Hill every day with our government affairs lead and our pharmacists, and they essentially talked about the issues that was facing the pharmacy practice and patients, and outlining policy solutions to fix it, which wouldn't just fix those patients' situation in the ICU, it was going to fix patients all over America. And so when I learned that I could have that type of impact, it drew me further and deeper into the public policy sphere. And I got my first co-sponsor as a pharmacy student when I was doing that internship. So I told the lobbyist I did his job. But it was easy to tell my story. And it was easy to tell how Mississippi, being majority of the state is medically underserved, how pharmacists were there and how they were accessible to better serve patients. And so that just really kind of started the story.
Wow. So you've lived the work that you're doing. Yep. That's really impressive. So I know this is bigger than just pharmacy, but your background is rich in this, and I do want to talk a bit about Amazon Pharmacy. I was really intrigued about that when I was doing some research on you. So let's talk Amazon Pharmacy 101. And for those in the audience who may not know what it is, or may be familiar with it, let's just set the stage and take an inside look at Amazon Pharmacy. What is its mission? How is it, fundamentally changing the way patients gain access to medications and just, the pharmacy services in general?
Yeah, Amazon Pharmacy 101. The goal, I think your wife said it the best, is to keep it easy and simple. We all know the healthcare system is complicated already, and it's only going to get more complicated the older you get, the more medications you're on. And so our goal at Amazon Pharmacy is to figure out how do we simplify the entire experience for the patient or for the customer. Some people don't want to be called a patient. And so what that looks like is still the same process you would see at any other pharmacy experience as far as how the prescription gets over to the pharmacy. So you either ask your healthcare provider, whether it be your NP, PA, physician, depending on your state, to send that prescription over to Amazon Pharmacy home delivery. And then if you do have an Amazon account, you go to your Amazon account through your app or online, and then you put that, and you would have to still add that medication into your cart like you do anything else. It does, just because the prescription comes over to you, it doesn't mean it automatically comes to your front door. You still have one more step to say, like, okay, I do need this prescription. And you add it to your cart, you upload your insurance information, and we provide you real-time transparent pricing, which now you don't get that. You have to go to the pharmacy, you have to ask, oh, can you tell me what my copay is? Which again, on the pharmacy side, that requires a bunch of adjudication on the back end, but this puts it at the patient's fingertips. So you can see the cash price, or you can see your insurance price, and we also have different discount programs called RX Pass, which if you're eligible, is $5 a month for Prime members, and you can get over 60 chronic medications. You'll have access to them. So we're going to figure out what is the lowest price for you to pay, and then we'll automatically apply whatever manufacturer coupons that are available to your price, so you don't have to go search that down either. It's all happening at one intersection, and then you get your price. You say, how do I want it delivered? Do I want it delivered to my front door? Or if you live in California right now, do I want to pick up at a pharmacy kiosk? And it comes to your house same day in select cities, where we have about 40 pharmacies right now, and they are all across the country. So in Durham, we have some in Durham, we have Texas, Michigan, North Carolina, California, New York, New Jersey. So they're all over, but you can get same-day service if you're in some of those select cities. If you're not in those select cities, we still ship to you from 1 to 3 days, which is still pretty darn fast. But that's 101. We have a bunch of features that we can get into later, but that is the experience. It's supposed to be easy and simple. And then if you have issues, we have a whole team that is dedicated to resolving them in a quick manner and
Yeah.
about
So
speed.
let's definitely put a pin in that kiosk concept. I want to talk a little more about that a little later. My background is education before the restaurant space and crazy enough to run for mayor. And something pretty big happened in education where we standardize the Common Core and essential standards across state lines, where no matter what state you lived in and didn't move to, you would get the same learning curriculum at the same time in whatever grade and quarter and unit you were in. Now, the pharmacy world, going a little deeper into policy here, is very complex, and so you're leading that space. One, I do want you to talk about what's the most rewarding component of that, but dig a little deeper into just policy, leading policy around pharmacy. It's all of these. It's multi-layer, and how do you navigate that space? I appreciate you all making it easy and simple for all of us out here, but you're in the behind the scenes, the sausage making process. How do you navigate that?
It's a good question, and it's extremely difficult. Most policymakers in the room, you guys know, it takes time to change people's way of thinking, and it takes time to change laws and regs. And what I didn't touch on before, in my background, I used to be the executive director for the Board of Pharmacy for Washington State, and so my job was I regulated the entire industry. So the pharmacists, the pharmacies, our technicians, our assistants. I took that job in 2019, right before COVID. And so I was there and I served during COVID. So I was really in the trenches to see how the sausage making was done, how we had to work closely with our mayors, with the governor, and with our other elected officials throughout the state. But it's extremely hard, especially in pharmacy, because pharmacy is one of the most regulated industries in this country. You can put a medical reg book up against a pharmacy reg book, and I guarantee the pharmacy regulations will be this thick. And it's because the Board of Pharmacy has oversight over controlled substances, all the drugs, and the facilities, and the profession. Whereas other professions, other boards, they only regulate the individual. And so it makes it a lot more complex. And what I'm seeing, to your point about we want to make it easy and simple, but to change the laws and to change the regs across the country to make that happen is extremely challenging. And what I've noticed is, before I had the Amazon banner, it was a lot easier to have the conversation. With the Amazon banner, it makes it a little bit more challenging. Either you're talking to regulators who are skeptical, right, or to regulators who want to be protectionist with their policies to protect their business. Versus saying, what's best for the patient and how do we give patient choice? But it's been extremely difficult to educate and socialize how we're trying to make it easier and how do we transform our regulatory environment and our legislative environment to support that.
Yeah, regulation, that's, I'm from North Carolina, that's a trigger word.
I'm from Mississippi, it's a trigger word too.
It takes, I think, to become a barber, I think it takes 2,700 hours to get certified. But you want to get a gun, you can just go straight on down there and get it. I think it takes like an hour or something. So here we are in the medical space and still dealing with regulation.
Which it makes sense, right? Because,
right.
We have people's lives at the end of the day, and so there do need to be guardrails. And I don't mean to insinuate that we don't need guardrails, but
right.
we also need to evolve and elevate the patient experience because no one, if you can raise your hand in the room, who had a great healthcare experience last time they went through the system? I don't think anyone's had that for some time.
Yeah, that's scary. All right, so on the flip side of this, considering no one raised their hand, you got to fix this. So what?
Lucky me.
So on the flip side, what keeps you up at night? What's the biggest policy change that we should look forward to, or if in a perfect world, what would be the policy change that you would create? So Dr. Lauren's magic policy wand waves what?
Yeah, if I could have it If I could have it my way, with the patient being the true center of everything, I would transform some of our regs that prohibit us from delivering medications through new technologies, and there are different ways that can be done, whether it's through lockers or pharmacy kiosk or drones, right? But right now, I would say 25 of the states in the country will prohibit a patient from going up to a pharmacy kiosk if one existed in your city or your state to pick up medication. So I have my work cut out for me to provide education and partner and collaborate with policymakers and regulators to say, where can we get to a point where you feel safe, but also where do we get to a point where we can get to yes for patients? And then on the other side is we have this thing in the pharmacy world called central fill regulations, and that prohibits some pharmacies from sending medications directly to the patient. And it's fine. The regulations are just outdated. I don't think they mean to be contrary to the future, but when we start educating policymakers on it, they're like, well, it's always been done this way because of the traditional models. And I think the traditional models can exist, but if I had my perfect world, we would create flexibility with the new times to make sure that medications, when they go to a second pharmacy, a central fill pharmacy, they can go directly to the patient, and so they can start taking their medications that day and not delay.
Yeah, let's lean a little deeper into that. That's very helpful. You're an expert in this space. We're going to rely on you for that. But mayors are expert conveners. Could you share maybe how we could be of assistance to if we want our constituents to be healthier, have better access? What types of conversations should we be having? You're going to be very technical in the policy space, and you're going to fix all the things behind the scenes, the complexities. But how would you consider you worked with the electeds before? How would you talk to us in helping to support getting your magic wand to bring those things to reality?
I think the best way is to continue to share your learned experiences, continue to share the story you have with your wife, continue to share learnings from this conversation, and also test it out yourself. I mean, I wasn't an Amazon pharmacy user before I came to Amazon, truthfully, and I didn't know Amazon had a pharmacy. So it took some time, and they've had a pharmacy for 5 years, but I think they're slowly building that awareness with customers. But I think it's what you would do in your normal conversations in your day-to-day. If there are conversations around healthcare policy, talking about what are those solutions, and look back, work with your state reps, right, having those conversations with your federal colleagues to say, we've noticed these blockers, and is there a way that we can convene in North Carolina to help lift some of these blockers, or in Minnesota, or wherever you are? So I think convening, keeping the conversation going, having the education, which is your background, right? Having those education moments for policymakers, I think is really where the rubber can hit the road, where people aren't, I guess, distracted by the banner, but more so focused on the consumer and patient.
Thank you so much. So we're running out of time here. Before I ask you your last question, would you be open to questions afterward? If anyone have any questions?
Yeah, happy to take questions after in the back.
Good deal, good deal. So she'll be here to take a few questions after we're done. So last question, what is the future? What is the future of Amazon policy from your perspective?
Well, if the one works, you would be able to, if you're grocery shopping, you would be able to finish grocery shopping and pick up your medications right there on the spot.
At the kiosk?
At the kiosk.
Okay.
If you are at your clinic, at your outpatient clinic, visiting your provider, you should be able to pick up your medication on the spot. If you don't have a clinic where where a kiosk is located, if you're on the home and there's a post office on the way home, maybe you pick it up there. Just think about innovative delivery models. We don't have to do everything the same way we've always done. And so if the one works, that's what the future looks like. And then if we fast forward to what the outcomes look like, we should see lower maternal mortality rates, right? We should see lower chronic disease rates. I mean, all the things we know to be true, those numbers should start trending down because you have people who are adherent. and hopefully we can improve outcomes, which has been my mission by choosing a career in pharmacy.
That's awesome.
Dankeschön.
Well, you know, we are the African American Mayors Association. One, I want to thank our leadership for bringing this conversation to the stage. We are very clear and understand that, and oftentimes it is our people, you know, that are suffering from access to medication, access to care in so many ways, and conversations like this can be real currency for us. So thank you for your time today.
Thank you all for having me. Thank you, Mayor Williams.
All right. Thanks, folks.